As the war in Gaza continues, a devastating number of children there are dying from preventable diseases and lack of medical care. In the first 3 months of this year, Médecins Sans Frontières teams treated more than 200 children under 5 for moderate or severe acute malnutrition. Jennifer Tierney from MSF Australia joins us now. Jennifer, good morning to you.
Good morning.
You're calling these the silent killings. Strong words, but tell us about those figures.
These are the deaths beyond the headlines. So you're seeing a lot of things that are killing children, women, and men inside Gaza that would have been preventable before the war. So the destruction of the health system and the fact that the capacity is so low within hospitals and health structures to be able to care for patients mean that patients are being turned away for things like diarrheal diseases and diabetes, and there is no patient care for people who are suffering from things like cancer. You know, we're treating as many trauma patients as we possibly can, but those who are vulnerable, now living outside in really poor conditions, suffering from things like diarrhea and lung infections, are not getting the treatment that they need.
And you're saying there, based on what you're hearing from the teams on the ground, that there is no end in sight, there is no sight of medical care being lifted to help deal with some of this crisis anytime soon.
I mean, not only is there no end in sight, you know, when we're talking about a potential siege on Rafah, which is the last remaining place in Gaza where there is a real semblance of medical care, it's going to get worse. And if that attack does happen, you know, the 5,000 patients that we're treating in that area every month are going to have no place to turn. You know, at this point, even in Rafah, where most of the population has been displaced, people are living in tents. They don't have access to water because of the lack of fuel coming in for desalination points. They don't have access to the food that they need because most of the food was coming in through trucking. There are only 2 points open into Gaza to get that food inside. And so we're seeing spikes in malnutrition and other diseases that would be entirely preventable if humanitarian aid were at the level that it needs to be.
It's not just physical health problems. MSF teams are reporting back on what they say is a mental health crisis really emerging in Gaza. Jennifer, tell us about that.
I think when thinking about the mental health crisis, you have to think as a community member or a parent. You know, you're living your everyday life and then you're displaced from the north of Gaza. You get to the middle, there's no place safe there. You're asked to move again to Rafah. When you get there, there's no place to go. We have staff members who are housing 30 to 40 family members and community members. We have people who are living on the streets with, you know, all of their children, pregnant women who are giving birth in latrines. It is a desperate situation which leaves very little hope and a very high level of insecurity for the community. And so the mental health rates are skyrocketing, and we're seeing children as young as 5 with suicidal ideation.
Gee, it's clearly awful for the people of Gaza. Jennifer, I want to end this by asking you, how are your teams, the Médecins Sans Frontières teams, holding up, doing some very hard work there under extremely challenging conditions?
You know, I've had some amazing conversations over the last weeks with our team members from Australia and New Zealand coming out of Gaza. They're doing as much as they possibly can within the means that we have. You know, they're establishing mental health programs, trucking in water, doing daily medical consults with pregnant women, but they are desperate to do more. You know, we talk about something called moral injury, when you know that you can help more, but you just don't have the tools to do it. So they are suffering, and particularly the Palestinian team members are dealing with the deaths of family, injuries to their family, injuries to themselves, lack of housing, and still showing up at work every day.
Jennifer Tierney from MSF Australia, appreciate your time this morning. Thank you.
Thank you. Thank you so much.